Yeah, it's very common for youngsters to come to the office here at Caring Medical. We've treated, the youngest person we've treated was 4 years old. It was a young child with Down syndrome who had dislocating patellas, and prolotherapy worked great for that child. But actually a really common thing that we see is growth plate injuries, like the long bones, the tibia bone, the femur bone, the humerus bone. It grows because we have these growth plates, and the bones grow through the growth plates. But it's common, especially in young athletes who play football, who play baseball, who play tennis, that they get injuries in and around the joints. And it's common for them to get diagnoses of growth plate fractures or growth plate injuries. Sometimes they're called apophyseal injuries or apophysitis. The most common one that we see is called Osgood-Schlatter syndrome, but again, it's a growth plate injury of the tibial tubercle. Kienbach's disease is another common one which affects the wrist, and Sever's disease, which affects the calcaneus, but there's growth plates all over the body. And normally what the orthopedic surgeon would tell the person is, you got to stop pitching, you got to stop doing the athletics. So in other words, they look at it as an overuse injury, where almost every single time when I see the young athlete, they got hypermobility, they got instability of the joint. So when you have instability of the joint, it's going to cause an increased pressure on their elbow, on their shoulder, on their calcaneus, and that's going to affect the growth plate. And that's why you have the injuries around the growth plate. So prolotherapy works great. You know, we've had athletes where they said you were going to be out of the sport for 2 months, 4 months, 6 months because you have a growth plate injury, you have an apophyseal injury, and we get them back really, really quickly because kids are growing. So all you got to do is stimulate those ligaments to repair, then the joint has stability, then the pressure goes off of the growth plate. So I mean, what a great treatment. Sometimes they'll even recommend to our, before the patient sees us, that they're supposed to get surgery for the growth plate injury, or they're supposed to get casted. So we take athletes who, instead of getting that treatment, they get prolotherapy. And then often once they get prolotherapy, they never ever have an pain in that area again because we resolved the underlying cause of the growth plate, which wasn't overuse, it was laxity. It was laxity of the ligaments causing instability in the wrist, instability in the ankle, instability in their shoulder. So definitely that's a common one that we see at Caring Medical and works great. Another one that we see commonly in young athletes is osteochondritis dissecans, which really is a kind of an apophyseal injury too, in the sense that you actually have a part of the bone or part of the cartilage actually is loose. But again, the cause of that is joint instability. So you have a young athlete who already has hypermobility of a joint, then all of a sudden they're pitching, you know, they already have like a loose joint, then they're pitching, and then that causes the ligament laxity to become too much. Then instead of hypermobility, they have instability. So by instability, I just mean that the ligaments can no longer keep the bones together. So that would mean like they get too much motion, and that too much motion causes increased pressure at the ends of the bones, and that can cause cartilage injury, growth plate injury. So a better treatment than stopping the sport, because what's going to happen? They stop the sport, then guess what happens? It just comes right back. So the patients we see, they've already gone through several rounds of that, and now they're going to get a surgery or get casted or whatever. And we just say, no, the cause of why you had the osteochondritis dissecans, or the reason why you had the growth plate injury, is joint instability. We're just going to cause the ligaments to repair. Normally it's a couple visits, you know, 1 to 4 visits, but normally like 2 visits in like a teenager or a preteen, and they just do great. So I know it's scary for the young people, you know, an 8-year-old, 7-year-old, 14-year-old, to get a whole bunch of shots, but if you tell them, you know, would you rather be off of your sport for 6 months or you get these shots, and then we gradually get you back into it. Then we see you a second visit, and then hopefully after the second visit, you're good to go. And by now, I have parents who I'll see them, and they'll tell me, hey, Johnny had a really good college career, and I saw him when he was like 13, you know, and then he got a scholarship as a pitcher in college. So we definitely have a lot of great stories from treating young athletes.